Hi everyone, welcome back to Dave's About Home Care, your go-to channel for all things related to non-medical home care. I'm Dave, a physician turned home care agency owner, and today we're going to dive into a very important topic. How can non-medical home care be a game changer for individuals living with Parkinson's disease? Whether you're a family member, a caregiver, or someone else who's been diagnosed with Parkinson, this video will shed light on the unique challenges that come with this condition and how non-medical home care can help improve quality of life. So let's just get started. First, let's talk briefly about Parkinson's disease to make sure we're all on the same page. Parkinson's is a progressive neurologic disorder that primarily affects movement. It happens because of a decrease in dopamine levels in the brain in the area called the substantia nigra. This leads to symptoms like tremors, stiffness, slow movement, and balance issues. Now, those are just the physical symptoms. There are also emotional and cognitive changes that can occur, such as anxiety, depression, and memory problems. It's a complex condition that impacts both the person with the Parkinson's and their loved ones. And while there is no cure for Parkinson's, there are ways to manage the symptoms and a good quality of life. And that's where non-medical home care comes in. Non-medical home care focuses on providing support with daily activities and companionship. This type of care is especially beneficial for people with Parkinson's because it helps address some of the challenges they face in their day-to-day lives. Let me give you a few examples of how non-medical home care can make a difference. Number one, assistance with activities of daily living. Many people with Parkinson's struggle with tasks that most of us take for granted. Things like getting dressed, bathing, and preparing meals. Having a dedicated caregiver can help with these activities and reduce frustration and maintain dignity for the person receiving the care. Number two, fall prevention and mobility support. Parkinson's often affects balance, making falls a significant risk. A non-medical caregiver can provide support with mobility, ensuring that the home is free of tripping hazards, assisting with walking, or transferring from a chair to a bed, and vice versa. Number three, medication reminders. While non-medical caregivers can't administer medications, they can provide reminders ensuring that individuals take their prescribed medications on time. This is crucial for managing Parkinson's symptoms. Number four, companionship and emotional support. Living with Parkinson's can be isolating. A non-medical caregiver provides companionship, which can help alleviate feelings of loneliness and depression. Caregivers can engage clients in activities that stimulate their minds and spirits, from playing card games to taking a walk outside. Number five, respite care for family caregivers. This is really important. Taking care of a loved one with Parkinson's can be exhausting. Non-medical home care can provide family caregivers with much-needed breaks to recharge and focus on their own well-being. The overall goal of non-medical home care for someone with Parkinson's is to help them live as independently and comfortably as possible in their own home. Think about this for a moment. Home is where most of us feel safest and happiest, right? By providing support with daily tasks and companionship, non-medical home care allows individuals with Parkinson's to stay in their familiar environment while receiving the care they need. Caregivers can also adapt care plans as the disease progresses. For example, in the early stages, a person with Parkinson's may only need occasional help with tasks like housekeeping. As the condition advances, however, they might require more hands-on assistance with mobility and personal care. Let me share a quick real-life example. We recently worked with a client. Let's call him Jim for the sake of this discussion. He was in this mid-stage of Parkinson's. Jim lived alone and was struggling with daily tasks, especially cooking and cleaning. His family was worried about his safety, particularly his risk of falling. We matched Jim with a caregiver who visited him a few hours a day, helped him with meal prep, tidied up his home, and kept him company. Over time, his caregiver became a trusted companion. Jim's quality of life improved dramatically. He was safer, more comfortable, and felt less isolated. This is just one of many success stories we see every day in non-medical home care. So if you or a loved one are living with Parkinson's, know that you don't have to face the journey alone. Non-medical home care can provide the support and companionship needed to maintain a good quality of life. If you'd like to learn more about how home care services can benefit people with Parkinson's, or if you're curious about what kind of care plan can be offered, you can send me a message here, drop me a note, or leave a comment, and I can answer any question you have. Feel free to reach out anytime. I'm always happy to help. And before you go, don't forget to like this video, subscribe to the channel, and hit that notification bell so you don't miss any of our future content. We're here to support you every step of the way. Thanks for watching, and I'll see you in the next video.